PathMock is the intelligent tool for website lead generation. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in their buying journey separates you from the competition online. PathMock qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50%. Add PathMock to your website in seconds. Let the AI do all the work and get access to 50% more qualified leads while you keep doing marketing and sales as usual. Check us on pathmonk.com. Welcome to today's episode. Let's talk about today's guest. We have Natalie from Zyter, Vice President of Marketing Strategy, Intelligence, and Insights with them. How are you doing today, Natalie?
I'm doing excellent. How are you doing, Ernesto?
I'm doing great. Thank you so much for asking, Natalie. And well, I'm sure, Natalie, our listeners are tuning in, wondering what Zyter is all about. So in your own words, tell us a little bit more.
Sure. So here at Zyter TruCare, we've been around for about a year. We are the combination of the purchase of CaseNet by Zyter Inc. that happened a few years ago. And we acquired CaseNet, which is the developers of a platform called TruCare, which is very known in the care management world, particularly in the payer space, and it has been around since the 90s. So over 20 years of experience managing complex patients in the areas of utilization management, care, case and disease management, appeals and grievances, medication management. And so we've combined the name Zyter and with TruCare, the name of the platform, married that, and we have Zyter TruCare. We are a company that serves over 45 million patients and members with our solutions, and we're unique in that we have a broad value proposition, in that we provide applied AI, wraparound services, interoperability, and that's essentially what makes us unique. We are more of a comprehensive digital health platform as opposed to a single point solution, which is needed with today's complex patient population and member population. We have 6 out of 10 individuals with 2 or more chronic diseases, and 4 out of 10 that have at least one chronic disease. So, in this day and age, it becomes increasingly important with an aging population and care shifting into the home environment that we have a comprehensive solution that can help coordinate care and manage these complex patients. That's in a nutshell how Zyter TruCare is unique and what we offer in the market today.
That's important. Okay. And so that way, Natalie, our listeners can get a good understanding there then of Zyter TruCare. What would you say then is that key problem that you guys like to solve?
Key problem is more of, I think, a summary of many different problems in healthcare. Healthcare, of course, is highly regulated. And we've moved, I would say, about a decade since COVID-19 with digital health technologies and that necessity to keep information and data secure, and HIPAA regulations, and of course overseas GDPR regulations. You have to solve all those issues in a digital health platform, in addition to being able to stratify your population and understand who's high risk, who's low risk, who do we need to spend more attention on, and how do we treat them best with technology and enabling our providers. So we're not actually the clinical providers, we enable them with these technology solutions. I'll try to be brief, but lots of moving parts when it comes to managing complex patients and care management across the care continuum, from the point that they're diagnosed and their disease state is maintained and improved. Lots of moving parts.
Okay, great. So then I don't want to assume here, Natalie, but would the vertical be or segment your ideal ICP? Would it be hospitals, or who else? What's your client?
Yeah, that's great question. Hospitals, so providers, as well as payers, and of course the government. When you're looking at population health and the individuals that oversee the healthcare, very large populations, you're dealing with a wide variety of buyer personas and customers. You're looking at the government as well. You're looking at the DoD. So we do have individuals that are insured by TRICARE. We have individuals, of course, different public health entities in the government, CMS, Medicare, Medicaid. So it's important to have that as a product. We speak to all these different buyer personas and, what their pain points are in terms of who they're trying to manage in terms of healthcare and their conditions.
Okay, great. Thank you so much so then how would somebody then, like, if I'll say I was in a hospital, how would I usually find out about Zyter TruCare? Is there a top client acquisition channel for you?
Yeah. So, and that's a great question. As a company with a brand new name, we have a product that's tried and true for many years, but they may or may not know it. And they're going to know us mostly probably through the class report, where in the past we've been voted best in class for the TruCare platform. And they'll stumble upon our website, I'm sure, that the rest of this conversation is about how we're utilizing our website and our resources, to increase brand awareness and ultimately bring in more leads and revenue. But we are also heavily involved in thought leadership, keynote speaking, content. We have bylines that are published almost every week, where one of our subject matter experts is featured in a major healthcare publication. We are often featured in news articles. So in combination of all those things, we're becoming more known. Of course, briefing analysts as well. As a former analyst, that's important too. Reaching out to the analyst community and making sure that they're up to date on our latest products and technology, and how we're solving healthcare's most complex problems.
Definitely important. Okay, and so that way, then Natalie, our listeners who are tuned in could go over and visit you. They could always check you out at Zyter.com. What role then does the website play for client acquisition?
Yeah, so great question. As marketing team has been around for a year at Zyter TruCare. One of my big focuses is on inbound marketing. So we generate tons and tons of content. And now that we have our marketing hub set up, now is the fun part where we get to take that content, get it on our website, have the contact forms queued up. People put their contact information in there, and now they're opting in or subscribing to our newsletters, which we send out to our prospects, our clients, in addition to the analyst community, and internal newsletters as well. So that's a prime way that we are getting leads, in addition to being out and about in conferences and events. But from a website perspective, we're going to be leaning heavily on thought leadership, powerful thought leadership and content in the forms of blogs, white papers, and ebooks. We have the advantage of having a very strong clinical team here. So people who have actually worked out in healthcare, one of them in public health. We have probably a half a dozen nurses as well. We have a chief medical officer, chief clinical officer, who have done the business of healthcare, have boots on ground, treated patients, and understand the challenges when it comes with that, in addition to healthcare regulations and how technology can help augment what they do. So that's a strong factor of our strategy in the marketing department is our content and thought leadership.
All right, great, awesome. Thank you so much for sharing about those also tips, their strategies that you guys have set up. And well, let's just gears then a little bit, Natalie, and let's talk about you as a leader. I mean, you're there, the vice president of marketing, strategy, intelligence, and insights. What are some key tasks you'd like to focus on your day-to-day work?
Yeah, so I have a really fun job because it's not just in one swim lane. I have a very non-traditional path from marketing. I started off in healthcare myself. I was in the U.S. Navy for 12 years. I was both active duty and a reservist. Did a wide variety of different roles when it comes to population health management. Also had human resources roles as well. And when I left active duty, went and continued my government service for the Centers for Disease Control, had the amazing opportunity to be a part of the COVID-19 mitigation effort as a part of the National Wastewater Surveillance System. Then ended up at Forrester Research, starting off as a senior analyst and working my way up to VP Research Director. With that came, obviously, knowledge on market research, but a variety of emerging technologies. And through that, it really opened up my eyes and ears to all the things that encompass what it takes to develop a successful product in today's digital health world, which is very, very different than it was, pre-COVID, and that rapid advancement that occurred, the rise of consumerism and this reliance on digital products and electronic health records, AI and predictive analytics to not only have telehealth and telemedicine, but to stratify risk as we have a population, sadly that I spoke of before getting sicker, and the cost of healthcare rising. We're now well over $4.3 trillion a year. So, having that eye and understanding what it takes to differentiate in the market in your different market segments, as well as the ability to develop KPIs and metrics in the field of product marketing, kind of brings it all together. You take the industry research, you take what your products at your current company are doing, and then you take the roadmap, that roadmap for platformization, what the product should be 5 years from now and 10 years from now. And you bring it back in to your current role. You work with the product team, you work with the engineers. Of course, you enable sales as well. And you bring that all together and you do your best to market the product and bring in leads, through websites and other modalities to increase brand awareness and differentiate in the market. That's in a nutshell what my role encompasses, which is a bit non-traditional and say a VP of marketing.
No, definitely. But I mean, you have a lot of insights. And how do you usually, is there a preferred channel that you like to stay up to date with all the news in the marketing world as far as strategies news?
Yeah, so it's definitely market research. And there's a variety of research that we do use. We are partners with Class, which I find very helpful when it comes to taking a look at competitors out in the field and all the different segments. Forrester has great research as well, not just because I work there, but from a qualitative standpoint and taking a look and differentiating one vendor from the next. Gartner has their own flavor, IDC, and so it's reading market research reports. Now on the other side of the table, I don't have the advantage of being able to sit in product briefings. We used to sit in 3 or 4 product briefings a day from companies, which was extremely informational and increased my knowledge tenfold. So now I've got to go the extra mile and find that in market research, talk to my own team members and understand things more and more from the product perspective and the development perspective. Attend those sprint meetings where you can get to see the latest of what's going on, the value propositions, why something was developed, talk to the nurses who can break down utilization management for me and, collectively take that and understand from a different perspective what I didn't have access to so much as an analyst. And that's the actual, line of sight to the development of a product from scratch, from product research to when it's being developed, you're getting the kinks out, and to when it's brought to market. So I get to see the full cycle of what it is to become a digital health product.
Okay, awesome. Thank you so much for sharing that with us and for our listeners. And Natalie, well, let's switch sections a little bit and let's jump into our rapid fire question rounds. Are you ready for them?
Always ready.
Awesome, great. Then first up then is, what is the last book that you read?
Oh my goodness. I have to say that mostly I've been in the weeds of product, and I've shifted from books to research articles and taking a look at news stories. That occupies a lot of my time. Marketing is it's rigorous, and you're always learning, and you're doing not only a lot of reading but a lot of hands-on work as well. And so a lot of my actual book reading has gone to the wayside, which I'm a little ashamed of, but have certainly replaced it with other types of readings. But I do like, the last book I recall was about David Goggins, and he was the former Navy SEAL. I'm sure you've heard of him, triathlete, and just a phenomenal human being all the way around. A little biased as a Navy veteran, but his story is truly phenomenal. He essentially says that most people work to about 40% of their potential. And, I'm a big believer in that. It doesn't matter what your background is, how you started, it's how you finish the race, and, really how much desire one has to succeed. if you put the time and effort into it, doesn't matter necessarily what your IQ is or who you know, it's how hard you're working, in addition to working smarter, not harder. But putting the time and effort in, if you can do that in today's world, in a technologically driven world, with things like generative AI available and ChatGPT, where there's a will, there's a way. And, as he said, push through pain. Not as much pain, per se in marketing versus being a triathlete. Can you hear me? I think
Yep.
my headset, oh, perfect. My headset kind of went out. But pushing through that threshold where, all of a sudden you shift from 40%, now you're at 80%, and that last 20% where you're working to your true potential. So I like to live by that philosophy. If you have a chance, go ahead and read his book. Truly phenomenal human being.
Yep, I would agree. Some of my friends have read the book and let me know, so I'll definitely have to check it out. Awesome. And then, Natalie, if there would be one repetitive task that you could automate, what would that be?
Repetitive task. That's a trick question, because I don't know so much if something is so repetitive, because especially in a digital world where things are changing so rapidly, and you've got to pay attention, because as soon as you're putting yourself on autopilot, you're missing things. But we certainly do a lot of social media posting, and there's ways to help automate that, and there's new advantages of using ChatGPT, per se, or other generative AI to generate posts. But I always feel that if you're automating too much, things, you're missing the beat. So with the amount of content and information out there, I would say that automation is certainly helpful, but you can't check out totally. You've got to be in tune to what you're putting out, and stay knowledgeable on those topics.
I love what you said, right? I mean, I think that there's a lot of people, wanting to automate everything last bit, but like you mentioned, right, they can miss that little beat, and there's a big opportunities there. So great to hear that from you. Next then is, if there would be no boundaries in technology, then Natalie, what would be that one thing that you want to have fixed for your role as a marketer today?
Yeah, technology is wonderful. It certainly makes our jobs a bit easier in some respects. For me, the advantage of generative AI and ChatGPT has made me more productive. I would say 400% productive. I'm somebody that has to know about, all facets of, what it takes to bring a product to market, from the product research aspect, many things that I don't know, super humbling. And so to take that, couple of minutes, instead of, back in the day, we used to go on Google and we used to read through Google Scholar and other journal articles, which are still important, which you have to do. But if you're looking for an answer in a pinch, what an acronym is, how one thing or concept interplays with another, that's where I like to go to ChatGPT. And so, not only just having that at your fingertips, but that's still only one portion of what we do in marketing. Then you have to develop the strategy, and then you have to motivate your team to execute the strategy. So that's where just, time and experience comes into play. How to take those concepts and how to take that data and that information that you're intaking, and how to put it into a plan that's effective, and that you can then, repeat over and over again, and then improve on your metrics, year over year.
Okay, great. Thank you so much for sharing with us there. And finally, Natalie, you have a lot of experience already in the marketing world, but what is that one piece of advice that you would give yourself if you were to restart your journey as a marketer today?
Wow, I think marketing is so much a part of a variety of different topics rolled into one. And advice, I didn't start off in marketing. I feel like I have an advantage. In some ways, it's a disadvantage, right? Because if I had to do it all over, maybe I would have taken some marketing courses in college. I would have maybe pursued my MBA, or maybe an MBA and an MPH. But then I wouldn't have had, the experience in infectious disease and the background that it takes to manage healthcare populations. But I would definitely say that the secret is being well-rounded. Don't just stay in one lane. be diversified, get knowledge from all different aspects and areas of study, especially if it's healthcare. Work certainly, work with a healthcare organization, go into a hospital setting. Perhaps it's a research role, but you have to be someone who's very empowered and somebody that looks to research, because that's how you learn and grow, and that's how you understand something from the ground up. You understand your buyer personas, you understand their pain points, and then you understand the regulations that guide the jobs to be done. And so I think that's extremely important, to be well-rounded, be motivated to learn, and never stop learning, right? Because in the technology world, things are changing every single day. And if you are snoozing, you are losing, and that next person is going to come up and pass you up in knowledge and perhaps performance. So that's what I would stress.
Definitely some great advice, not just for yourself, but for every listener out there. Thank you so much for sharing with us, Natalie. And well, Natalie, we are coming to the end of our show today, but before we do end, I do want to give you the last word. Say someone forgets everything about the interview today, what is that one thing they should remember about Zyter TruCare?
That's a good question, because there's a lot to learn. But I think when it comes down to, there's a lot of choices. The consumer has many, many choices when it comes to what healthcare solution that they should, be interested in and ultimately purchase. And I think it's important to look at the individuals behind that solution, look at what they stand for, look at what their prior careers were, take that into account, that not only do they know the technology, but they understand the industry. And it's not enough to be able to produce technology that works and it's efficient. It's someone that understands the workflows of the jobs that need to be done by the end users and the ultimate goals. And in our case, it's population health management and improving healthcare outcomes, making workflows better. If you include everyone at the table, all your stakeholders, when you're evaluating technology and what to purchase, you will find that they will look for those things. Everyone at the table has a different interest. Some might be cost, some might be, does this make my job easier? Does this make my patient healthier, my member healthier? I think it's important to go with a company that services what they sell and that has the background to produce great products that are differentiated in the market.
Definitely. Okay, awesome. Great. Thank you so much for sharing with us, Natalie. And to our listeners, you could always check them out at Zyter.com.